Weekend. Kids are building forts, the kettle is on, and then, someone starts sniffling. I remember last winter, mid-game, my little one turns to me and says, "My throat feels funny." That tiny line changes everything. Today, we're offering a doable, safety-first 48-hour kitchen plan you can try tonight. Listen to your body and your family, and let's make a plan that helps without overpromising.
Welcome back to Earthy Remedy, where natural remedies meet real food and better you. I'm Fiona. Today, our promise is simple: a short, clinician-anchored toolkit to support mild colds or flu for 48 hours. Broth, a throat sip, a kid-friendly congee, steam alternatives, and clear red flag language so you know when to call a clinician.
And I'm Samnang. We're joined by Dr. Maya Singh, a family physician who will help us keep safety front and center, and Lian Chen, a clinical herbalist who will help us keep the remedies kitchen level, low dose, and sensible. Hello both. So glad you're here.
Thanks, Samnang. Fiona. Hi, everyone. I'm glad we're talking practical steps, what families actually do in their kitchens, plus how to spot the things that need urgent attention. Happy to be here. I'll keep our demos strictly culinary, gentle doses you can trust, with swaps for different ages and diets. We'll avoid anything that could be risky for asthma, pregnancy, or infants.
Before we dive in, quick safety frame. Dr. Maya, tell us, what's the typical course of a garden variety cold or mild flu, and what are realistic goals for home care in the first 48 hours?
Great question. Most mild viral respiratory illnesses start with sore throat, runny nose, low-grade fever, and fatigue. In healthy adults and many children, the first 48 to 72 hours are about symptom management, hydration, rest, fever control when needed, and watching function. The realistic home goals are keep fluids up, maintain comfort, monitor for red flags, and avoid harmful practices. If someone is eating, drinking, and their alertness is normal, that's reassuring. But home care isn't a replacement for evaluation if things worsen.
From a nutritional perspective, this is when we focus on easy-to-digest, nutrient-rich foods that support energy and hydration, not heavy meals that can make people nauseous. Think broths, diluted herbal sips, simple congees, small, frequent intakes.
That feels doable. Okay, segment 2, red flags. Dr. Maya, give us the exact wording listeners can use to decide if they need urgent care. Say it like we should read it aloud to worried parents.
Yes, if you notice any of the following, seek urgent care right away. Difficulty breathing or shortness of breath, chest pain or pressure, persistent high fever that doesn't come down with acetaminophen or ibuprofen, severe trouble keeping fluids down or signs of dehydration, confusion, drowsiness, or a change in how alert someone is. For infants under 3 months with a fever, call your clinician immediately. If you have asthma and breathing worsens, get help sooner. Those are the stop rules. Don't wait.
That's perfect phrasing, clear and direct. We'll include this exact wording in the printable checklist in the show notes, so you can have it at the top of your sick day plan.
Bridge. Let's prep our kitchen. I'll read the quick checklist slowly so folks can gather supplies. A small pot, a mug, measuring spoons, a spoon for stirring, a fine strainer if you have it, a thermometer, and either a cool mist humidifier or a towel for a steam alternative. Put these within reach.
Segment 3, evidence and limits. Leon, give us the short version. Which culinary tactics have supportive evidence for symptom relief, and what should listeners avoid?
Culinary hydration, broth and warm teas, helps with comfort and can increase fluid intake, which supports mucus clearance. Honey in children over 12 months can soothe cough and sore throat. Steam inhalation can ease nasal congestion for some adults, but undiluted essential oils or forceful inhalation can trigger bronchospasm, especially in people with asthma, so we discourage that. Humidifiers that add gentle moisture are usually safer. Also, small, calorie-dense, easy textures like congee help when appetite is low. We'll keep doses low and kitchen-based, not medicinal-scale tinctures. Randomized trials show modest benefits for honey on cough severity in children older than 1, and good evidence that hydration and rest improve subjective recovery. But there's no home remedy that shortens a viral course dramatically. That means our approach is supportive, comfort, safety, and making sure we don't miss red flags.
Okay, let's get cooking. Demo A, a restorative single-serve broth bowl that supports hydration, sodium balance, and gentle protein. I'll read the ingredient list slowly. Pause if you're cooking along. Ingredients: 1 cup 240 milliliters low-sodium broth or stock. If you only have bouillon, use 1 vegetable or chicken cube in 1 cup of water. 1 small thumb-sized piece of fresh ginger, peeled and thinly sliced. 1 clove garlic, lightly crushed, optional if you can tolerate it. 1 teaspoon miso or tamari for umami and tiny sodium boost. Skip miso for infants under 1. 1 tablespoon of cooked shredded chicken or soft tofu for protein. 1 tablespoon of finely chopped scallion or chives. A squeeze of lemon if you like, and a pinch of black pepper or white pepper. For vegetarian option, use vegetable broth and extra tofu. For toddlers, reduce salt and skip added miso unless diluted and in very small amounts.
Nutritionally speaking, small protein plus warm sodium-containing fluids help restore appetite and can prevent low energy. Keep the overall salt mild, about 1/4 to 1/2 teaspoon total for an adult serving, unless your clinician has advised otherwise.
Step by step. Step 1. Pour 1 cup of broth into a small pot and bring it to a gentle simmer. Step 2. Add the sliced ginger and garlic. Lower heat and let it infuse for 5 minutes. You'll smell that warm ginger aroma. That's the comfort cue. Step 3. Add shredded chicken or tofu and the miso or tamari. Stir until combined. Step 4. Simmer another minute, then remove from heat. Step 5. Strain if you prefer a clear broth. Ladle into a mug. Add scallion and a squeeze of lemon. Sip slowly. Start with small sips every 5 minutes to check tolerance. If you feel worse at any point, stop and reassess.
Tip: if you don't have fresh ginger, use 1/4 teaspoon ground ginger. If appetite is low, blend the broth and chicken into a silky consistency, easier on the stomach. For pregnancy, ginger is generally safe in culinary amounts for nausea, but keep herbal additions minimal and discuss any herbs with your clinician.
That smells like home. Small sips, tiny bowls. This is nourishment, not a big meal. Okay, Demo B, gentle throat sip and steam alternatives. Leon, lead us through the throat sip recipe and the safety notes.
Throat sip. Ingredients for 1 cup. 1 cup hot water, 1 chamomile tea bag or 1 tablespoon dried chamomile, 1/4 teaspoon grated fresh ginger, and for adults and children over 12 months, 1 teaspoon of honey to soothe. Steep chamomile and ginger for 5 minutes. Strain. Add honey once it's warm but not boiling. Sip slowly. For infants under 12 months, do not use honey. Use plain warm water or breast milk or formula as advised by your clinician. Important: do not use undiluted essential oils in steam or in the cup. Those are strong and can cause breathing problems. Instead, for a steam alternative, use a cool mist humidifier in the room or a bowl of hot water placed safely on a table while you sit at a safe distance and inhale the moist air. Never lean over a pot with scalding water. People with asthma can have bronchospasm from strong aromas or essential oils. If someone has asthma or is pregnant, stick to cool mist humidifiers or the distant bowl method. And if breathing worsens at any point, stop the steam approach and seek care.
From the evidence side, humidified air can reduce nasal irritation and improve comfort. Chamomile has soothing properties and low risk in culinary doses. Honey reduces cough severity in older toddlers and children. But none of these replace medical assessment if red flags appear.
Demo C, appetite-friendly congee for kids. Ingredients for a single toddler-friendly bowl. 1/2 cup cooked rice or 1/4 cup uncooked short grain rice rinsed, 2 cups water or low-sodium broth for a softer texture, a small piece of cooked mashed carrot or sweet potato, 1 tablespoon plain mashed cooked chicken or mashed white beans for vegetarian option, a tiny pinch of salt, about 1/16 teaspoon, or omit for babies under 1 year, and a drizzle of olive oil, or a dab of butter for calories if needed. Steps. Step 1. In a small pot, combine rice and 2 cups water or broth. Step 2. Bring to a boil, then lower to a gentle simmer and stir occasionally for 15 to 20 minutes until very soft and porridge-like. Step 3. Mash in the cooked carrot and protein. Adjust texture with extra water to make it spoonable. Step 4. Cool to warm before offering. For little kids, offer a teaspoon at a time and watch for swallow and intolerance. Packaging tip: if you need to take it on the go, keep it in a thermos for short periods and rewarm gently.
If appetite is very low, make the congee more liquidy and add a splash of breast milk or formula for infants as appropriate. For older kids, a small sprinkle of grated mild cheese can help with calories and acceptance, but avoid strong spices. A word on medication interactions and dosing before we move to household care. Acetaminophen is safe when used correctly, but do not combine 2 different acetaminophen-containing products. For children, dose by weight. Use your dosing chart in the show notes. Avoid over-the-counter decongestants in young children. Many are not recommended under certain ages. If someone is on prescription anticoagulants or immunosuppressants, check with the pharmacist before adding herbal supplements.
Segment 7. Household Care and Pacing. Quick practical rules. Rest is treatment. Caregivers, rotate breaks every few hours if possible. Wash hands often. For high-touch surfaces, use a regular household disinfectant. And if someone is sneezing a lot, a simple surgical mask when close to others can reduce spread. If space allows, gentle separation for the most symptomatic person helps nighttime rest.
Also, think about sleep cues. Keep lighting low in the evening, reduce stimulating screens, and aim for consistent fluid checks so dehydration doesn't sneak up. Small adjustments, warm socks, a comfy blanket, help with perceived comfort and rest quality.
Laundry and cleaning, high-touch items like remotes, phones, and doorknobs can be wiped. Bedding can be laundered if there's heavy nasal discharge or fever, but everyday household cleaning is usually sufficient. No need for extreme measures. If you're worried about exposing high-risk household members, consider masking and closer monitoring.
Segment 8. How to run the 48-hour microtrial. Fiona, walk us through the single change rule and what to track so people can tell if a remedy is helping.
Keep it simple. Change only one thing at a time. For example, try the broth bowl at your next mealtime. Track these metrics every 4 hours. Fever, use a thermometer and note readings. Fluid intake in milliliters or cups. Appetite, record small, medium, or normal. And symptom severity on a 0 to 10 scale for throat pain and congestion. Also note function, sleep quality, and activity level. After 24 hours, compare. If you see improvement in the metric you're tracking, that's useful information to share with your clinician. If things worsen, follow the red flag language Dr. Maya gave us.
And when you do a microtrial, make a small note of any other changes. Did you also give medicine, or did someone get a nap? That helps you and your clinician interpret results. Final safety recap and medication quick guide. Acetaminophen can be used for fever. Dose by weight in children and follow the dosing chart in the show notes. Don't give aspirin to children with viral illness due to the risk of Reye's syndrome. Avoid multiple products that contain the same active ingredient. If you're taking prescription medicines, call your clinician or pharmacist before combining herbs. And remember the red flags: difficulty breathing, persistent high fever, not drinking enough fluids, or decreased alertness. Seek urgent care.
Reflection and encouragement. This is about small, practical steps. One small change, one broth bowl, one restful nap. You've got this. Start small. Try one demo tonight and see how the microtrial goes. Be kind to yourself as a caregiver.
We'll drop a printable 48-hour checklist, a dosing and interaction sheet, and minute markers for the recipes in the show notes so you can follow along. If you're unsure about combining anything with a medication, call your clinician or pharmacist. Don't guess.
One last line to take with you. If in doubt about breathing, fever that won't come down, inability to keep fluids, or altered alertness, seek care promptly. Those are not steps to wait on.
CTA time! Try one demo tonight and tag @EarthyRemedy with a 15 to 60-second voice note about your 48-hour microtrial. Tell us what you tried, how you tracked, and one small thing you noticed. We'll share standout stories in future show notes. Also, download that printable checklist. There's a dosing chart and the exact red flag language.
Thank you, Dr. Maya and Leanne. This felt like a really useful, safety-first set of tools, rooted in the kitchen but connected to medical sense. The evidence supports comfort-focused care, and your practical tips make it doable.
Thank you both. Gentle kitchen remedies done well can help people feel cared for. Be safe, keep doses culinary, and check with your clinician when in doubt. Thanks, everyone. Take care of each other and use the checklist. It's a small tool that can make decisions clearer when you're tired and worried.
Closing. This episode was about practical, food-first actions and clear safety boundaries. Remember, listen to your body. Trust the earth. Feel the difference. We'll see you next time on Earthy Remedy.